first session today is a very interesting one because it follows up on something that AAKP has been involved in for the past 2 years. For those who tuned in last year, you would have heard from Jack Fisher, who we will hear from again here in a minute. In 2019, AAKP at the Global Summit committed to provide patients around the world with the tools they needed and the insights and the skills that they needed to have an impact on their governments and on payment and regulatory decisions. And we also wanted to make certain that patients could get organized to raise their voice and be of assistance to private sector companies that were involved in developing clinical trials and new medical devices, so that we as a patient population could view one another as a team around the world, and to make certain that we were learning from each other and impacting policy so we can actually get greater care choice and access to new innovations, and that we could be strong partners for the private sector folks who have the courage and the energy and the investments to make certain that we can bring new products to save more lives into the marketplace. So last year we were joined by Jack Fisher from the World Health Organization. And the World Health Organization had focused on this global summit as a mechanism for organizing patients and experts from the medicine field and from the research field and from the private sector. They thought it was a good example. So they asked us to become involved in the development of a global framework for engagement for people with chronic diseases. Let's go ahead and listen to what Jack said last year.
Hello there, my name is Jack Fisher. I'm a technical officer here with the WHO Global Coordination Mechanism on NCDs based in Geneva, Switzerland. And it's a real pleasure today to be able to speak to you as part of the 4th Annual Global Summit on Kidney Disease Innovations. Today, I'd like to spend the next 10 to 15 minutes talking about WHO's efforts around meaningful engagement of people living with NCDs and mental health conditions, and the process and the eventual launch of a WHO framework to support that aim. So before we jump into some of the specific work that I'm involved in as part of the Global Coordination Mechanism on NCDs, I want to take a step back and refer to what we are talking about when we refer to non-communicable diseases and mental health conditions. As you can see here in the diagram, the so-called 5x5 model, which was updated as part of the 3rd UN high-level meeting on NCDs in 2018, refers to the so-called Big Four as part of the NCD acronym: cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and their associated risk factors, as you can see at the bottom of that diagram. But I very much want to acknowledge that as part of this work, we also include other chronic conditions and other lived experiences, which includes individuals living with kidney disease. And a big focus of this work around the framework is really trying to promote the idea of an intersectional approach, both when it comes to tackling NCDs and mental health conditions, but also integrating the lived experience as a form of expertise as part of this evolving and very exciting work within WHO.
So what's interesting about this is for patients that are living here in the United States, we have the great benefit and the tremendous privilege of working with our federal government in a way that most countries do not model. And it's very important for us as the Global Summit and as AAKP to make certain that patients around the world have the same opportunities to impact policy and decisions that we have here. For example, the U.S. Food and Drug Administration has been very forward-leaning, especially on the medical device side, for working with patients to get their patient insights and lived experiences brought into the federal regulatory process. Same with the Department of Defense on the Congressionally Directed Medical Research Program, the U.S. Department of Veterans Affairs, and of course, the National Institutes of Health, and especially NIDDK. For these organizations of government here in the U.S., they lean into the patient community, and we are officially represented in many different capacities. However, the patients we work with around the world were intrigued in 2019 at the number of federal officials who were involved and what seemed like an infinite amount of access that we had. So when we came to the attention of the WHO, we told them that we would work with them and collaborate with them on developing a framework so more patients around the world could have greater impact on their governments and in their work with private sector industry. And now what we'll hear is from a very fantastic person, Yvonne Arivalagan from the WHO, who is the co-author of the actual framework itself. which is being announced here for the first time in the US. And she is a veteran of the World Economic Council and the United Nations and an expert for the WHO on engagement. We'll let her go ahead and walk through what the elements are of this engagement platform and the role that we're playing as patients. Go right ahead, Yvonne.
Hi, everyone. Thank you so much to AAKP for this wonderful invitation to speak at the 5th Annual Global Summit on Kidney Disease Innovations. My name is Yvonne Arivalagan. I am a stakeholder engagement and policy specialist at the Global Coordination Mechanism on NCDs at the World Health Organization. And it's my privilege to be here to speak about our very recently launched WHO framework, which I'm happy to present more in detail today. So a full title, of course, as you can see, WHO Framework for the Meaningful Engagement of People Living with Non-Communicable Disease and Mental Health and Neurological Conditions. So just to set a bit of context, kidney disease obviously falls very much within WHO's 5x5 NCD framework, cutting across chronic respiratory disease, cardiovascular disease, diabetes, cancer, and mental health conditions and related risk factors. So over the last 2 to 3 years, we've had the tremendous privilege of co-creating this framework with over 300 people with lived experience, including people living with kidney disease. So we would not be here without the help and the contribution and the support from this vast global community. So the WHO framework, before I even start going into detail about what it is founded upon this principle of the right to participate. And the right to participate is enshrined in WHO's constitution as an essential part of the right to the highest attainable standard of health. And so we treat meaningful engagement here not just as a tool, but as an important and rights-based approach and methodology in improving health outcomes for people living with NCDs, mental health, and neurological conditions. So it's a very important underlying principle. So this slide is just to underscore that WHO is committed to operationalizing the meaningful engagement of people with lived experience. This framework is a technical product, which means that WHO and member states are guided to operationalize and implement meaningful engagement within the regional and country context in co-creating and enhancing related policies, programs, and services. And in this diagram, what we're really saying is that traditionally the balance of power within WHO has been weighted towards member states, scientists, United Nations, so member states, of course, meaning ministries of health, governments, and using methodologies and processes involving biomedical models and classifications of NCDs and health conditions, and also quantitative data. And not to say that these aren't all critically important within the global health conversation, but through this framework, we want to tilt the scales, restore some balance in favor of people with lived experience, recognizing that lived experience is a form of expertise towards civil society voices and organizations, many of whom do significant work on the ground in the community with people with lived experience, marginalized groups and communities that have traditionally, historically, systemically been left out of the conversation, to typically do not have a seat at the table. So it's about folding these groups in, qualitative data, so personal histories, narratives, stories, to complement that very important quantitative piece, and also a variety of independent voices, just outside of this very traditional power structure that we have. So the process, the road towards the creation and the development of this framework has been ongoing for the last 5 or 6 years, but in particular in the last 2 years. So in 2021, following the first global informal consultation with people with lived experience, we released this Nothing for Us Without Us report that really kind of talked about some of the key principles and enablers for meaningful engagement. Following that, in the lead up to the development of this framework, we've also engaged in a number of what we call evidence generation activities, including case studies, consultations with each of the WHO regions, films, animations, all of which, as you can see on the screen here. People power, as you can see on the screen, is one of our publications within what we call the Intention to Action series. So that really dives into the stories of 12 individuals, so in-depth case studies with 12 people living with a range of NCDs, mental health conditions, and neurological conditions. Regional reflections, that goes into important regional perspectives, contexts, nuances that we need to pay attention to. So how are NCDs, mental health conditions experienced in Southeast Asia versus in the Middle East versus in the Americas? What are the differences? What are the priorities? All these together really have fed into the WHO framework, which was released in May of this year. So, as mentioned at the beginning, the right to participate is really what underpins this entire effort. So, we actually spent the first half of the document of the framework talking about what this means, an overview of participation and participatory approaches in health. We talk very much about power, discrimination, and health inequity, understanding and acknowledging that historically there have been some groups that have had access to power within decision-making spaces, whereas many other groups have been left out of the conversation, left out of having a seat at the table, and marginalized. And how this has created inequity within, especially within the NCD mental health and neurological community. We talk about also the origins of participation within global public health. So the HIV/AIDS movement from the 1980s was very much an inspiring movement that we used to learn from and get some key takeaways as to what could be important for the similar movement for NCDs. We also acknowledge some recent progress in participatory approaches in global public health, so including with healthy aging, disability rights, mental health, social participation, and really acknowledging that while the concept of meaningful engagement may be novel within the NCD context, it's certainly not new within a broader global health context. And we are inspired by and take lessons away from many other communities. And then we go into a few important participatory approaches that we recommend within the framework. One example of one of these approaches that we recommend within the framework is the principle of person-first language. So I don't think this is new to many of you in the conference. Person-first language, of course, means addressing an individual as a person rather than as a condition or a classification of multiple conditions. They may not be common or preferred terms, so when in doubt, ask the person to avoid any risk of using derogatory phrases. So as you can see there, person with a psychosocial disability or condition or with a particular lived experience. That's extremely crucial within this work. So this slide really presents an overview of the DNA, if you will, of the framework. We start with 5 key underlying principles or guiding values around meaningful engagement, starting with treating all people with lived experience with dignity and respect, acknowledging the balance of power in the room and restoring some of that, creating equity, bringing people with lived experience to the table, ensuring inclusivity, but also intersectionality, acknowledging that people with lived experience, their experiences are affected by their gender, nationality, age, multiple other identities. And these are important to take into context when they affect their experiences as well. Ensuring commitment and transparency throughout the process from start to finish, not just taking meaningful engagement as a tick box exercise or an ad hoc engagement, but really folded into the process from start to finish continuously. And also that meaningful engagement should very much be institutionalized. It should be part of the DNA of any organization's decision-making culture around these conditions, but also contextualized within a regional or country-specific focus. These principles then feed into 6 core enablers. Enablers really are the more how-to strategy on implementing meaningful engagement. And this is really about sustainable financing, so ensuring that people with lived experience, speakers, or in a variety of roles, are compensated fairly for their engagement, that power is redistributed through clear roles, responsibilities from board members to peer support leaders across that spectrum of professionalization. Eliminating stigma through language, but also day-to-day practices, legislation, integrating meaningful engagement in all manner of decision-making, within WHO, within government, but also integrating the NCD mental health and neurological condition agenda with other related health agendas as well, acknowledging that lived experience is very much intersectional and comorbidity. People live with multiple comorbidities. Capacity building really refers to building the capacity of individuals to better advocate, to form partnerships, to lobby or persuade and speak to members of government, but also the other way around. How can the capacity of WHO and member states be built to better meaningfully engage people with lived experience using rights-based participatory approaches? And then finally, institutionalizing engagement, whether it's through legislation or other really formalized processes. These ultimately feed into actions, both for WHO and for member states. So as you can see on the table on the right, we've organized this according to a phased or structured approach from bronze, silver, and gold, so that stakeholders can track their progress. And this slide is really to underscore that people with lived experience, their voices, their stories have underpinned this effort throughout. We have captured some of these stories through short film and through case studies. And as I mentioned at the beginning, this effort could not have been made possible without their incredible contributions. And this is a busy slide, but this is really just to underscore that now that the framework has been published, the work does not stop there. And our next steps include implementation, creating additional derivative products, further contextualizing and adapting the framework within regional and country contexts to ensure that the framework then becomes widely operational in the long term. So just as an example, these are some of those additional activities that I mentioned. We have a pilot project for implementing the framework within the Eastern Mediterranean region. We're also looking at a WHO symposium, people with lived experience, really like a conference of people from all over the world to come together to talk about issues that matter to them, aligning with other major global health agendas and events like the high-level meeting on NCDs in 2025, for example. We're also building a WHO roster of consultants to support some of our work on lived experience. So individuals who will be paid, hired to actually support us on this work, whose lived experience would be treated as a necessary requirement and as expertise for the role. We're also launching a working group, a scientific working group on meaningful engagement to really support us with those research, scientific, evidence-based concepts and products that are related to the framework. So this is really just a snapshot. And this is really a final slide to underscore once again that this effort was really a co-created effort from over 300 people from all around the world. So thank you so much to AAKP as well. We've benefited so much from support from organizations such as yourself, and we're very happy that the framework is finally launched, and we hope to continue working with you in the time to come. So thank you very much again for the opportunity.
Thank you very much, Yvonne. And it's been an absolute pleasure for us to work with fellow patients around the world and get them involved in the writing and preparation of this framework. And one of those patients is a very good friend of mine, Job Wako from Kenya. And Job is a kidney transplant recipient. He's 7 years out. He got his transplant from his sister. He has organized transplant education in Kenya, and he has raised the voice of activists and professionals in the transplant process. Let's go ahead and listen to how he's using the framework in Kenya. Go right ahead, Job.
Thank you so much, Paul, and AAKP and the George Washington University for having me. It is such an honor to speak at this platform, to have this chance to tell my story and give my insights. So my name is Joab Wako, and I'm a chronic kidney disease patient living in Nairobi, Kenya. I've had chronic kidney disease for 8 years. I was diagnosed actually in the US, in Alabama, in UAB, in 2015. And I was lucky enough to get a transplant, a kidney transplant in 2016. But I had to go to India to get my transplant. So that is my story. When I went to India in 2016, I had very little information about chronic kidney disease. You can imagine at the time I crash landed onto like kidney disease. and the doctors actually were wondering how I was functioning. My HB was 3.8, and when I walked into UAB, they were like, "How is this young man functioning?" In fact, the nurse at the desk stopped me and asked me, "Hey, are you sure it's 3.8?" And when they did the test, they found out it was 3.8, and that my blood was very, very low. My HB, or hemoglobin, was very low. And that's why decided to become a kidney or a patient advocate, because I was young at the time. I was 24 and didn't know anything about chronic kidney disease. So when that happened, I was so shocked when I was told about it, and I didn't even know what to comprehend and what to start, with treatment, or with my with my treatment. So I was taken to the HDU and eventually the ICU, and that's where I was stabilized, and I started dialysis. So my first dialysis session was a shocker. I didn't even know what a dialysis machine was. So I started learning from there. Luckily for me, I had a social worker who took the time to talk me through chronic kidney disease and told me about chronic kidney disease and what it is and how you can live well with chronic kidney disease. Took me through dialysis, took me through what a transplant is, and that's how I started now talking to my family. So I come from a family of four, and I am the youngest. Uh, so we're six in total with my parents. But those conversations around organ donation and donating a kidney, I had to basically have that conversation with them. And it was so enlightening for me to have someone to walk me through that, to kind of tell me, hey, this is what a kidney transplant is, this is how you talk about it, this is how you ask. And my sister, who I follow, so I'm the youngest of four, and my sister, she came to me and just told me, you know what? I feel if I'm a match, I will donate my kidney to you. So that was one of the happiest days in my life. I remember thinking about it and just saying, wow, how lucky am I to have someone who wants to donate to me? So she came to the US, and this was in 2015. And at the time, I was living in a town called Gadsden, Alabama. And she came there. We went to UAB to test, and I found that everything is good, but we couldn't get an estimate of how much the kidney transplant would cost. Uh, and at that time, I wasn't fully covered with insurance. So I had an insurance, but the cover wasn't a big cover. And when we went to the hospital, they couldn't give us that figure. So we had discussions with my family, and we decided, hey, maybe it's better we just come home to Kenya and then decide from there, because we weren't sure about the cost of the kidney transplant and how much would be covered by insurance. So we came back to Kenya in late 2016. I remember I came back in August of 2016, and that's where now we started the preparations for a transplant. We decided to go with India because India had the expertise, and we wanted the transplant. It's called laparoscopic. So we wanted a laparoscopic kidney transplant, and that's where they were doing that. So did all the paperwork, went to India in October of 2016, and that's where we got the transplant. So luckily she was a match, and everything worked out. We're the same. She's O negative, I'm O positive. So the transplant proceeded. So got the transplant on the 30th of November 2016, and that changed my life. So when I came back home to Kenya, there was very little awareness around organ donation and kidney transplantation. And so that's what sparked my passion for advocacy. So I started now reaching out to my friends. I had made some friends in India. So I got my transplant in New Delhi. It's in Gurgaon, but it's very close to New Delhi. And so the friends I had made there who were getting transplants were not only kidney transplants, but they were like liver and bone marrow. So we all had transplants. So I told them, hey, a lot of people are asking me about kidney transplant and the details around it. Why don't we do something to educate the public about organ donation, about kidney kidney transplantation, about all these other types of transplantation, because it has changed my life significantly. And they were also passionate about it, and we decided to found an organization called Transplant Education Kenya. So we founded that in 2017. It was eventually registered in 2018, and that's where the work around awareness on organ donation began. It was super rewarding to do it. I met so many people in the space, and eventually I connected with other organizations in public health, I would say. And when we started now doing the advocacy, I think one thing that really stood out was the lack of awareness in the public. There were very few people who knew about kidney transplant. In fact, here in Kenya, there's a bit, I'd say, of a taboo talking about organ donation. There's a feeling that if you donate, you'll get kidney disease as well. So there was a lot of misconceptions, a lot of myths and misconceptions around organ donation. And that was where the work began. So the first step we decided to do was to just do a lot of advocacy and a lot of raising awareness. So the organization we founded is called Transplant Education Kenya, and the main thing we do right now is raise awareness about organ donation and transplantation here in Kenya. And we do this on social media by telling stories, by posting illustrations, by posting any posts around organ donation in the world, so that we can raise the awareness here in Kenya to really fight stigma and discrimination, and show people here in Kenya that you can live well with a kidney transplant. So that was the main agenda, and that's how I ended up linking up with other organizations, and eventually the work we did around lived experience with WHO. So that began in 2020, around when there was COVID, and that's when I found out about WHO's Global Coordination Mechanism, or the GCM. And they were doing several regional consultations and focus groups in like WHO regions. And I was lucky to be one of the patients who was able to talk or to meaningfully be engaged in that process. So the insights from all these consultations, and there's a film on Nothing for Us Without Us, fed into the co-development of the WHO framework for meaningful engagement of people living with NCDs and mental health conditions, which is scheduled to be released in 2023. So it was released on the 11th of May, and the document or the framework, the meaningful engagement of people living with, it's a framework from WHO. In fact, you can search it and see it online. Please download it and read it. It is a very, very powerful document because it provides practical guidance and actions on meaningful engagement of people with lived experience through principles, enablers, and actions. And so it helps us as people living with or people with lived experience to engage our governments very meaningfully, in that for me, it enlightened me on how governments, implement, like go from policy, how they implement the changes that we want to see, so that I can be meaningfully engaged throughout the whole process, not just like as a token, because a lot of times what happens is the government will just put you in the places where they need to, and then they leave you out of the other parts of the decision making and, how it's implemented, because these are the things that we're asking for, as a person living with chronic kidney disease and a kidney transplant, to be more specific. The things I've witnessed, the things that I've seen that I can contribute to, in that when I see or I go on the ground, I'm the one who knows what's going on, or my friends, we have groups, we have WhatsApp groups where we talk about what needs to be improved, or the pain points, what are we experiencing in regards to our healthcare. So the WHO framework on meaningful engagement kind of gives us like an overview of how to engage the government meaningfully and to know what's missing, because I'm not an advocate at first. In fact, I'm trained as an engineer. So it's nice to know that WHO has kind of created a way for us to engage, to look and say, hey, how can I reach out to my government in a way that is meaningful? And that way I can be effective. If my government doesn't tell me about a platform I'm supposed to be at, I can look at the document and find out, hey, this is where it needs to be. This is how they make decisions. This is what I need to do. So that is why this document for the framework is super, super important. And I'm so proud to know about it, to be part of it. And I hope that it helps us as kidney patients globally reach our goals, reach our healthcare goals, in that when we're going to the hospital, we need any healthcare, see our doctors, we know what needs to be done and how we can effectively talk to our government to improve our healthcare services. So that is what I would like to say about the advocacy, my journey so far, and how I was plugged into the framework for meaningful engagement by WHO. And to my fellow kidney patients, I know that it's a journey, and I'm just praying and hoping that we continue to push and advocate powerfully and reach the goals that we need to. Thank you so much.
Thank you very much, Job. And so for everyone that's watching this, and for those who are in the room today, I also want you to know that Job has taken his experiences, and he is now the chair of the liaison committee to the International Society for Nephrology for Patients. So he has taken that example, and not only is he leading in his own country, but he's leading around the world and giving that voice of patients to inform doctors and other professionals who are developing policy at the international level. And so we're very pleased to have been a part and work together as partners. He's a good person, and he's really doing the best he can over there in Kenya and throughout Africa and other nations to raise the awareness of the patient journey. All of this wouldn't be possible as advocates to try to engage government and work with government if it weren't for leadership on the other side. And that's with public leaders who understand the burdens of kidney disease and who lean forward to patients.